Memorial Medical Center is undertaking the most significant expansion in the 115 years of its history. We are undertaking a mission-driven, patient-centered endeavor here at the Medical Center because we want to accomplish three things. We want to improve privacy, we want to enhance patient comfort, and most of all, we want to create a safer environment for our patients.
Well, the project that we're about ready to engage in is really an upgrade of a number of key areas in our facilities and our services, not only to upgrade some of our existing infrastructure, but also to help prepare us for the future. And we've had to prioritize over the last number of years of exactly how do we want to grow the organization, where do our physicians and our community need us to expand. So there's 3 or 4 key areas that we're going to address through this expansion project. The first being our patient tower.
We are building 3 new units with 114 single occupancy rooms. So there'll be private rooms for every one of our patients. And probably the biggest gain in all of our project is that the rooms will be about twice the size of our current rooms. So the additional space is going to provide us additional work area for our caregivers. It will provide a lot more space for our patients and our families. And it provides atmosphere of comfort and quiet. When we sat down to design this project and the units in the patient rooms, we really tried to keep our strategic goals in mind. Great patient experience, great place to work, and great results. And those really drove our site visits, and we went to the literature and looked at evidence-based design from the architectural literature to say what are hospitals doing to improve outcomes for patients and caregivers and provide great patient experiences.
In addition to the private rooms, which should reduce infection rates and hospital-acquired infections, the other key components are that we're creating and developing family space.
Their families are actually going to be able to have accommodations and space and be able to be with their loved ones during the healthcare experience. A lot of research has shown that family involvement in care and patients who have family and loved ones around them during their period of sickness and health challenges recover faster and more holistically than they do if they don't have those support systems around there.
The second part of the project is we are expanding our perioperative capacity. We're going to add 5 additional operating rooms so that we can continue to grow our surgical services. In addition to that, we'll have all pre-anesthesia, post-anesthesia expansion, and we're going to make it much more convenient for the patients because we're going to put it closer to the front door so they don't have to traverse through the organization.
What we're doing now is relocating that admit function just inside of the main lobby. So now the patient is going to have approximately 50 steps to come into the facility, check in for their procedure, go down to the surgical suite, and then come back up to meet their family and then exit the facility. So convenience and access is really going to be a nice improvement for this portion of the facility.
Well, the benefits I see in a new facility, new design, we learn every time we build something, and so the patient transport from admission to the pre-anesthesia area, to the OR, to the recovery will be so much better and so much more efficient, which is good for the patient.
The third big part of the project is we are building a new center for learning and innovation, and it's very exciting. It's something that's not available anywhere in the region. It's going to give us a chance to really increase our capacity for education and for learning, not only for our own workforce, but we're partnering with the SIU School of Medicine to expand our surgical skills lab. We want to increase the training for residents and for medical students. The Memorial Center for Learning and Innovation will house a number of functions. On the first floor, we're going to have a large conference center that will house about 375 visitors. So it'll be much larger than our current conference center. It will also house a cafe so that we will have some alternatives to our current cafeteria. The second floor will be predominantly learning for our Memorial employees. We'll have computer labs, we'll have formal classrooms, and then we'll also have a formal lecture hall for visiting professors or community events that require a more formal setting. The third floor will really be designed for clinical simulation.
I think this new facility is going to showcase Memorial's desire to continue to provide excellent medical care and show the community their commitment to improving the education and pushing the envelope to have the most state-of-the-art educational opportunities for both its own workforce and the School of Medicine's learners, be it undergraduate medical students or resident physicians. And really looking to the future, to have that kind of partnership from one of your hospitals with the School of Medicine, it speaks volumes to have us involved in the planning stages of this, and we've been very excited to be a part of it.
Finally, we're enhancing the lobby and the front entrance to the hospital. Right now our lobby is a little confined. We're going to open that up, get some new light in there. We're going to expand the entrance to the hospital so that it's not as crowded when it comes to dropping off patients in our driveway.
Currently, we've got a little bit of a bottleneck at the front door, and that one lane of traffic, we're going to expand that to 3 lanes. So access is really going to be a key in improving the convenience for the patients and the visitors to access the facility.
Our facilities design team have spent a lot of time trying to determine how can we upgrade our current infrastructure as it relates to our energy systems. Right now, a lot of our energy systems are aging, and we had a decision to make. We either upgrade our current infrastructure or we build a whole new energy plant. We elected to upgrade, so we'll be replacing some of our boilers, our chillers, and a lot of the parts and pieces that you normally don't think about when you enter into a hospital. We are really excited about this expansion project. We've been planning this for 3 to 5 years. We've gotten input from community members, physicians, employees, and we really feel we're positioned to advance our facilities, advance our care through some great design. We want to make sure that we improve the comfort for our patients and their families and make sure they have safe environments.
Memorial's vision is to be a national leader for excellence in patient care. The completion of this project is going to allow us to get closer to that vision.